All right, making sure this starts. Okay. Hi, my name is Inga Jordan. I am a student nurse at Bates Technical College, and I am performing the task of urinary catheterization with a Foley catheter. And I've read the physician's orders and indications. I've reviewed the facility's protocol, and I have gathered my material. So now I'm going to enter into the patient's room so I can initiate and complete the task. Hello. My name is Inga Jordan. I am going to be your student nurse today, performing the procedure with you. So just give me a moment and I'll give you more details. Okay, ma'am. Before I get started, I just want to identify who you are. Okay. So you said Lizzie Thin, 5, and your date of birth. 5/8/1948. Okay, great. Let me just kind of look it over here on your. All right. So that lines up. Do you have any allergies? I noticed that there are a couple on your wristband. So ink and iodine, which lines up with your band. And fortunately, the procedure that we're doing for cleansing does not contain iodine or ink, and she does not have latex. No latex allergies. She said no latex allergies. So we'll begin the procedure. So, Lizzie, I just want Miss Dan. What I want to do is get you prepared to, so that we can complete the procedure. There's a couple of things. It's a little invasive. It's going to be in the vaginal area, and I will be inserting a tube into your bladder so that we can capture urine because you've been retaining urine. So I just wanted to tell you that before I start moving into your personal area. So the first thing I need you to do is take the covers all the way down here. Okay, I have a drape prepared to cover you and keep you warm, but I am going to have to position you up in such a way that you're covered and you're here. What I will have to do is position your legs up so that I can best visualize there. Your legs won't move. Visualize the area. Okay, so now let me just go ahead and cleanse the area so that we can make sure that it's prepared for the procedure. I'm going to wash my hands one more time. Okay, put on some clean gloves. Okay, I have wipes here that are pre-warmed, and they're cleansing wipes just to clean the perineal area. So, Lizzie. Okay, just to review, I have obtained stimulating, having obtained privacy prior to initiating the procedure. Okay, I'm just going to clean here. Now pack this dry. Okay. Okay, so my next step is to prepare the catheter kit. And I'm going to do so by placing it here in the area where I'm going to perform the procedure. So here it is. I've opened it. Okay. Okay. Now I'm going to open the sterile field. I'm going to go ahead and, wait, before I do that, let me just get these gloves on one more time, because I want to use the bag here to, that's available to me to dispose of items. And making sure that I do not cross the sterile field. The bag will be right there. Okay. And put it on my sterile gloves. Okay. Now I'm going to prepare the kit so that I can complete the task. And I will need assistance. Do you have an assistant, please? If you can come from the back angle here and thank you. And just lift the drape up so that I have visualization of her.
Sure.
Yeah. Okay, and just be careful not to touch the sterile field.
Okay.
Thank you. Great. Okay, so what I'm going to do is go ahead and reach into the field here with my hands, and I'm going to first prepare the lubricant and removing the draping around the simulated, removing the draping, and I'm going to place the catheter into the lubricant. Then my next step with my sterile, I'm going to drape her. Using the fenestrated drape, I'm going to cover and create more of a sterile field and around here. Okay. So I'm going to now cleanse the area with cleansing solution. Okay, opening the area. Okay, and I'm going to remove the catheter with my clean hand, 3 to 4 inches away. Okay, Miss Lizzie, this may be, it's going to go into the urethra. If you feel any uncomfortable feeling, let me know, and I'll slow the procedure down. And what I'm going to do is enter into the urethra. It's already, all right. Slowly enter. Okay, is that uncomfortable? And I've inserted it until I see urine coming into, yes, there's urine there. And I'll take it in 2 to 3 more inches. Okay, now I'm reaching for the sterile. I'm going to add water and inflate the balloon. Okay, slowly insert the saline solution into the, okay. All right, and I'm just gonna give it a little bit of tug here to make sure it's not coming out. That means it's nice and secure. Okay, there. Okay, so now the catheter is in place. My responsibility to prevent infection is to make sure that the catheter bag is below her bladder. So I'm going to hook it onto an area on the bed below her bladder that doesn't move and tug at the placement. bag and just a specialized thing here to just, I'm simulating putting the secured wrap on here to keep the catheter in place. And now I'll just go ahead and clean everything up. Oops. And make sure that she's comfortable. Okay, how are you feeling? Okay, do you have any questions or concerns? Okay, your catheter is properly in place. And I am going to, if you don't have any questions, I'm going to now clean my area. I'm going to go document the procedure and any questions or concerns that the patient has. I will make sure I communicate to the physician or whomever, and process is now complete. Hi, my name is Inga Jordan. I am a nursing student at Bayes Technical College, and today I am performing the task of urinary catheterization using Foley catheter. I've read the physician's orders and indications, facility protocol, and I've prepared my material. So now I'm going to go in and see the patient and perform the task. Hello, my name is Inga. I am a student nurse today, and the doctor has some specific orders for you. So let me get my hands cleansed and we'll get started. Okay, so before we get started, I just need to know your name and date of birth. Okay, Lizzie Fenn, 5/8/1948. Okay, great. Let me just check it, please, against your wristband. Okay, that lines up and looks like you have some allergies. And what are your allergies? Ink and iodine. So she does have an iodine allergy according to that, but fortunately the procedure that the kit that I have does not use iodine. She also does not have latex allergies. So I've raised the bed to a comfortable height and it is flat that will allow me to perform the task. So Miss Lizzie, today I'm going to be inserting a catheter, a Foley catheter, and it's going to go into your private area. I just want you to know that that's what we're doing. It's going to go into your bladder in the area of your vagina. And so I'm going to have to position you with your permission so that we can do that. Okay, it's fine. So let me know if you feel uncomfortable in any way. All right. Okay, so I need to pull this up a little bit. I'm going to get you positioned. Oh, let's get you positioned into the dorsal recumbent position. All right, that way. Okay. Are you okay? All right. I'm just going to drape you so that you're warm during this procedure and comfortable and for modesty. All right. So the next step I really need to do is make sure the area is clean initially. So I'm going to put on some clean gloves and I'm going to go in and clean the area, the perineal area. Okay. What is wrong with these gloves? Too much time on that. That glove wasn't opening, Miss Lizzie. I don't know why, but these do. So I have some pre-moistened warmed wipes that are cleansing wipes. So I'm going to start here. Right? Cleanse the area. Okay. She's nice and clean. I'm just going to pat it dry. Okay, you doing okay? Okay, great. Okay. Use the whole box of gloves here today. Now what I want to do is prepare the catheter kit and get started by taking it out of the packaging here. And my sterile gloves prepared. Okay, so I'm simulating that I initiated the process by obtaining privacy. So privacy is obtained so that I can continue. Okay, so here I've taken it out of the kit. I have this bag. I'm gonna place it at the very end before the sterile kit. So I can throw my things into there. This is here. Good. And I'm gonna place it away. Only touching the outer edges of the sterile field. I'm going to take these gloves off and I'm going to wash my hands. Okay, now I'm going to put on sterile gloves so I can complete the process. Touching the inside of the gloves. Okay. Okay, so now that I have sterile gloves on, I'm going to go ahead and set my patient up. Make sure she's okay. Put in a drape under her. Going to apply additional sterile field around the vaginal area. And I'm going to prepare my kit quickly. I'm going to, in this open area, I'm going to insert the lubricant. I'm removing the covering on this catheter tip and placing it in the lubricant in preparation for insertion. And I'm now using the cleaning gauze to have the tip, not gauze, but the Q-tips to clean her. Okay, again, these are non-iodine. So first thing I'm going to do is open and prepare this for cleansing. Let it cleanse away. Away. And internally. There we go. Okay, now removing. I'm bringing the catheter 3 to 4 inches from my hand. I'm going to slowly insert it, approximately 2 to 3 inches, until I see urine flowing. So I do have a urine flow, so I'm going to go in just a tad bit more, a little less than 1 inch or so, to make sure that it's inserted beyond the urethra into the bladder. And this will allow me to go to the next step of using this saline and inflating the balloon. So I'm going to remove this tip here. Going to insert the saline slowly. Okay. Are you doing okay? Any discomfort? You're doing fine. She's doing fine. Making sure that I'm going to insert and you feel just a little bit of something inside of you. Let me know. I'm going nice and slow to make sure it's done properly. Okay, and then I'm just going to go just and tug just a tad bit to make sure that it doesn't come out and it feels really secure. So at this point, I'm going to make sure that I take the catheter bag itself and hang it below the patient's bladder. allows for proper flow, prevents infection. I'm going to hang it on an area on the bed that doesn't move, and it's nice and secure. And I'm going to simulate securing the tubing to her leg to make sure that it's secure and doesn't pull out. And at this point, I'm done. I'm going to clean the area, make sure the patient is comfortable, cleanse my hands, and then I'll go document. Okay, well, I'm gonna just follow through on that real quick. Okay, doing okay? All right, so I will finish that task. I'm going to end the skill, wash my hands, and document.